Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand, and now I'm going to demonstrate how to do deep tendon reflexes. There are two types of reflexes, the deep tendon reflexes and superficial reflexes. And this video is about deep tendon reflexes. For that you need to have a reflex hammer, and there are two types. This is the conventional type, so I've got this one and I'm going to use this, and it has to be tested both sides. And I think you need to develop proper skill to do it, because you don't want to unnecessarily harm the patient, because of course this is going to hurt a bit. So if you explain to the patient that this is the rubber thing and I'm going to be as gentle as possible, then patient will tolerate it. So again we have to test both sides. Let's start with this one. So the philosophy is that when we strike a tendon, it produces a stretch, and that stretch actually initiates the contraction. This sensation goes to the spinal cord, and then from the lower motor neuron, it doesn't go to the cortex. From the lower motor neuron comes back in the muscle and translates into contraction. And the contraction should be seen when the part you're doing should be actually inspected also, and you can also see the movement, the flexion. So let me do this one. I think the best is first you locate the tendon. So this one is the tendon, and I put it here, and then I lift it and do it. So you see this movement? So try to be as gentle as possible. Typically we do it twice, like this. On the other side, this is the tendon. Okay, I'm first going to put it here and then slightly lift it. See this movement? Okay, this was brachioradialis reflex. Now we do the triceps. Very convenient. We can just flex the arm like this, and this is the part where I'm going to strike. So first I'll put it here. I think it is best to hold the handle from here so that you get maximum flexion. This movement, this is the movement you are expecting. So this is normal. Then I do on the other side. I'm going to see this movement and also the muscle contraction. So like this. So this is it. And this was the triceps. There is the nerve root of every reflex, and that you need to learn. I think when we do the biceps, we typically put our thumb here, because this tendon is quite deep and it might not be easy to strike it directly. So we use our own thumb, and I'm going to see this movement. You see this movement, and I'm seeing the movement here also. Muscle is contracting, biceps muscle. Now on the other side, this is how I find it convenient to do it this way. See this movement? So this, as a result of this hammer strike, muscle should contract. And now I think the most important, in the sense that this is what you're going to be asked in the undergraduate examination. So this is best to keep it halfway, not fully extended, not fully flexed, halfway, like this one. And I might put my arm underneath to just, because patient may be paralyzed and patient might not be able to hold his leg. So this much. First I can see the tendon, but I'm going to demonstrate it to you. This is a tendon. So I'm going to see. I think it is best if you expose this part also and see the muscle contracting. See this muscle? Then the other side. So muscles are contracting, and there is a tension here also. So now the ankle jerk. Again, it has to be at a right angle. There should be an appropriate level of tone in this by extending it halfway like this here, and I will first put it here and then lift it. See this movement? And then on the other side. Okay. So this was the usual deep tendon reflexes. There's a jaw jerk also that I demonstrated in examination of cranial nerves. There may be a situation when you are unable to elicit a deep tendon reflex. So there is a mechanism you can actually enhance the reflex. And if you're doing in the upper limbs, and suppose you are doing it and like this, and there is no response, but you actually want to make sure that this is actually absent, you ask the patient to make some motor activity above this level. In the upper limbs, I will ask him to clench his teeth. जोर से दबाना, जोर से दबाएं, नहीं अपने दांतों को जबड़े को दबाना, like this. Okay, so that is one thing. And when I doing it in the lower limbs, ऐसे पकड़े, जब मैं कहूँगा ऐसे जोर से खींचे, जब मैं कहूँगा भी नहीं. So I am doing it, and if I am unable, in this case the reflex is elicitable, but if I am unable to elicit it, then when I do it, I will ask him to make this forceful movement. नहीं, that very moment, जब मैं कहूँगा उस वक्त करना आपने. आप करें, like this. So this was exaggerated. अभी छोड़ दें, अब फिर करें. See, with this movement somehow this gets exaggerated. So if this you will need to do only when reflexes are not elicitable. So this is called gyndrastic procedure. If after gyndrastic procedure the reflexes are not elicitable, that would mean that they are really absent. Thank you.